Global health experts are calling the outbreak large and complex. Officials from the World Health Organization spent the past week overseeing South Korea's response to the MERS outbreak and to advise measures to contain the spread of the virus. Luckily, though, the head of the investigative team says there's no indication the MERS virus has mutated into a more transmittable strain.
But what we can say is that the outbreak is showing epidemiologic patterns which are similar to previously seen outbreaks occurring in hospitals in the Middle East.
One reason the virus has spread so quickly in South Korea, the WHO says the practice of doctor shopping or going to several medical clinics to receive treatment may have played a role. In addition, overcrowded emergency rooms and the local tradition of patient visitations facilitated the virus's proliferation. That prompted the country's acting prime minister to plead with the public earlier this week to avoid any unnecessary hospital trips.
I urge everybody to limit visits to medical facilities, and in particular, the elderly should refrain from hospital visitations.
The South Korean government is under criticism for its slow initial response to the outbreak. In fact, the names and locations of hospitals treating MERS patients weren't publicized until weeks after the first confirmed case. But the WHO says the current quarantine and monitoring systems put in place are now adequate.
So here I'm very happy to report that these steps, much stronger contact tracing, monitoring and quarantine, facilitated by greatly expanded laboratory diagnostic testing, have been put in place and are being strengthened.
The WHO team also warned that South Korea will likely see more sporadic cases of MERS patients, including some in the general public, in the coming weeks. Also, to prevent a similar type of outbreak in the future, the team recommended the country invest more in the public health and medical health care systems, including more infectious disease specialists, epidemiologists, and laboratory capacities. Shane Hong for CCTV, Seoul.